Hello there, Rikitsa Prastigard here. 5 reasons to treat minimal invasive, so to speak. What's this about? Welcome, and well, I'm gonna tell you what my reasons are and see if you find the same values. Here we go. The first major reason is aging, because all over the world our challenge is that our patients keep getting older and older. And this is everywhere. And patients getting older expect to keep their teeth. They are very aware of their health and their looks. So they expect to keep their teeth, and they expect to have healthy, beautiful teeth and smiles. And I totally understand them. So how are we going to meet that demand? With all the challenges we have, at least we have to start early to think about it. So we start when they're young and even younger than this. If we're like a family dentist, but when we meet new patients or just our regular patients, we have to ask ourselves, if you're 25, if we probably will live until we are like 95 or something like that. That's a lot of years the teeth has to be in the mouth, in that environment that is where there is a cocktail of challenges. So we have to think about that when we see patients, so they can go into that third age like vibrant old people with a great life, a healthy life. We all know that diseases in the mouth has the possibility to affect your general health. So it's very, very successful for us to prevent infections, to prevent disease in the mouth. So what are the challenges, the normal challenges? That a lot of people are medicated, and medicine is one of the huge challenges in the mouth. So we have to tell our patients that. We have to be aware of their general health issues, because it's going to affect the mouth. And some patients are severely affected by this, with mouth dryness and all kinds of things going on. It can be reflux, it can be all kinds of things throughout lives that ruins things for us and for the dentist. It can be all kinds of parafunctions. It's not just grinding on tooth pressures, wearing the teeth, it's erosions, it's people put all kind of strange things in the mouth that affects the teeth and the gums and everything. And then it's all the bad habits, all the normal habits we challenge throughout life. And these are just 3 simple ones, but there are a lot of other issues we have to address. And this is, we have to be co-working with the patients, and we have to make sure that they understand what kind of responsibility they have in this quest of keeping their teeth. So that's one of the issues, how we meet that challenge, because it's not our responsibility alone, and we have to teach our patients that they have the greatest responsibility. We can coach them, we can support them, but they have to do the hard work. So how do we coach? How do you coach your patients, and how do I coach my patients? We could talk a lot about that, but it's important that we coach them. And how do we plan and treat? Because is it important that the treatments last? I see a lot of dentists, and I see a lot of materials in this industry that is getting stronger and stronger. And maybe we should ask ourselves, what is important? Is it important that our treatment lasts as long as possible, so that the patient doesn't have to pay for another treatment? Or is it important that teeth survive life itself and the treatments? Because it's not all treatments that are good for teeth, I think, but that's my opinion. And life is a challenge for teeth. So aging is a problem. When we lived until we were like 45, 50 years years ago, we were not that challenged. We didn't live that long. But now we doubled the age. So this is a huge challenge that we should, as dentists, be aware of every day in our office. So, reason number 2, predictability and possibilities. So, what do I mean about that? I hate this feeling of having a crystal ball and be able to look into that and see, oh, how's it going to work for this tooth? If I have a patient coming with a problem with decay underneath a bridge or something, and I have to treatment plan that, it's complex. So how can we make the teeth more predictable and get more possibilities? I think we should be aware that less treated teeth are always more predictable and more reliable. It's of course you can have perio disease and you can have all kinds of diseases, but when the teeth are more or less intact, they're stronger, they're more resistible, and it's easier. You have more possibilities, and it's easier to examine them, and it's easier to retreat them. When you have more tooth structure, life will be easier for you and for the patient. So that's my opinion, and that's one of the major reasons for me to treat less invasive than I normally did in my life as a dentist. So, more possibilities for you and your patient in the future. It's great to have possibilities in the mouth because they have a lot of years to live in. And what about crowns and bridges? What's the prognosis? How often do you extract teeth that has been crowned or bridged or treated a lot where you have secondary decay? Or what about endodontic treatments? How often do you extract an endodontically treated tooth because of fracture or because of decay or because of lack of healing? And what about implants? What's the prognosis there? And all these treatments are very expensive. People find them extremely expensive, and patients think that, okay, now I had a crown, then nothing is going to happen to this tooth, and now I had an endodontic treatment, now it's dead, and everything is good, and it's just sitting there. And it's a huge challenge to coach our patients in what are the prognosis. So how do I think that we get more predictability and more possibilities? I think the first step is balance, because when we talk about treating less, balance and occlusion is important, because if we have imbalances in your body, you get problems. You can have all kinds of nice treatments. If the occlusion doesn't work, you're gonna have bridges that wears loose, where they loosen on one of the pillars, and you have secondary decay. You can have fractures. You can have implants fracturing. Balance is really important, and in balance, I'm talking about occlusion, and it's not difficult, but it's a challenge. Occlusion, healthy pulps, and healthy gums. That's these three last points: balance, healthy pulps, healthy gums. That's one of the most important things in my practice. Can I reach this? Then I won't say I'm home safe, but I'm pretty safe, I think. So reason number 3, visibility and accessibility, because it's so important if we want to do less treatments, that we see the decay, we see the problems early, and we intervene. So what do I mean about it? I mean, when we do diagnostics, when our hygienist is examining both on x-rays or intraorally, how easy is it to diagnose or to examine at the margins of full crowns, and how easy is it to diagnose on the x-rays? I think we all know that if diagnosing decay underneath a crown is a challenge. We often are too late. And then we have all this decay and we have to think about how to retreat it. We have to do a root canal. So that's a challenge. So can we choose materials that does this that makes it easier for us to visibly diagnose the decay earlier than we normally did. And I think we have materials where we can succeed in that and be quicker to treat and have less complications. So when we treat, then we have to think about where we put the margins, because it has to be visible and accessible for ourselves and our hygienists. So where there are not highly aesthetic demands, then don't put the margins beneath or at the margins, because it's going to be difficult for the patients to clean, and it's going to be difficult for us or our hygienist to diagnose an exam. So this is just a simple onlay on this tooth with a bad infraction or crack. But this is about, it's a tabletop prep, and the margins are almost everywhere subprogingival, and it's so much more easy to exam. And don't care about this margin. It's a lower molar. She's not going to show this margin, so life's just easier. So think about that because it's a challenge for us in the future to exam if the margins are not accessible. What about this old male patient here? He has done a lot of dentistry. It's been expensive, and he is like 76 now. So, and he's healthy, but he has all this decay underneath the bridges. He's a class 3, and what are we going to do with him? We've caught this decay too late, and he's gonna lose a lot of these bridges, and that's one thing. But what are we to what are the possibilities now for this patient? We have less tooth structure. We might have complications with decay that reaches the endodontically treatments, and that's gonna influence the prognosis of the tooth. We have to redo the root canals if we can even use the tooth. So what's his possibilities? It's implants or partial dentures. And how's his economy? Are we able to give him a good treatment, or is he going to wear nothing and just be worse off than where we started? So I try to avoid these kind of treatments nowadays, because I don't feel secure when people get older. So we have to ask ourselves that question: how do we treat? Because it's gonna challenge us later in life. So think about what possibilities you leave yourself after treatment. Number 4, economy. And here I'm talking about mainly the patient's economy, I think, for now. What is the value to your patients? And I think I think you should ask your patients what's value to patients, because it's not all about money. I think it's a lot about security. It's about health. I've asked a lot of mine, and they don't mind investing in teeth, but they have different limits throughout their lifespan. So when they're young, they can't afford that much. And when they get in the midlife and they have their businesses or they have their employments, they have some more money to spend on teeth. But in their late life, when they are retired, most people can't afford that much treatment. So I think that's important to keep in mind, that we have to think that be aware of the different challenges patients have throughout life to be able to afford treatment. But all of them, when I ask, want to keep their own teeth, and they want them healthy and nice. So that's a demand or a need they want. That's a dream they have. So how that's a challenge. So we have to make this work. So what about your economy? What if the patient loses their teeth around retirement or earlier, and they don't have money for implants and bridges? Then it's prosthesis or nothing. And would you make great money on that? I don't think we will make great money on that. So if patients are 60 and they lose a lot of their teeth and they go to have removables or partial dentures, that's no money for us. So we have to we have to be aware that the patient have different limits throughout their life, but we can manage that and still be able to make money on the patients later in life, just doing other kinds of treatments. So don't be afraid that treating less invasive is less money in the long run. It's just another way of treating and another way to make money. So will it be a win-win situation if the patient loses their teeth? No, it won't. It will be a disaster for both you and the patient. But can we make this a win-win? Yes, I think we can. And there will be so much to do, and there are lots to make a living of. Because as I said earlier, treating less invasive doesn't necessarily mean treating less or earning less. It means doing things in another way to reach the goal. And the goal is to keep the patient's teeth in the mouth as healthy as possible. So that was the fourth issue, the economy, both yours and your patients. So the fifth is more quality in life, and this is a huge topic all over in your life. It's not just in your profession. But do you ever feel exhausted in meeting all the demands of the day? I do, and we have challenging days at the office. We have hectic, chaotic days. We have a lot of decision all the time and a lot of responsibility. And at home, we have the private lives. We have kids, some of us, partners, friends, ourselves. How are we going to meet all those demands when we have too much responsibility, or we feel too pressured by the everyday demand? So we are all challenged with this balance about expectations and responsibility, and expectations and responsibility, and often it leads to some kind of stress or some kind of dissatisfaction in life. And I really think we should create more quality in our lives, more value. And this differs from person to person, but if you make your life more easy at the office, there will be a spin-off in your personal life. So, how come less invasive treatments can give you more harmony or more quality? I think it does because it gives meaning, value, and purpose to the way you treat. You have a strategic thinking about how you treat when you treat less invasive. And you get a more simple life, professional life, and more balance. And that's not just in bites, as I told you earlier, it's in your life too. And we have to protect both. We have to protect ourselves, we have to protect our life, we have to protect our patients and their teeth. And we do that in creating some kind of balance in life. And it has to give some kind of meaning, and there has to be a purpose to it. Otherwise, there will be no value. And no value, you will just deteriorate in your mind. So, 5 reasons to treat minimally invasive, so to speak. It's my best reasons: aging, predictability and possibilities, visibility and accessibility, economy and more quality in life. This is important. So what now? You have taken your first step towards less invasive dentistry just by clicking this link, and it starts in your mindset. You have to ask yourself, how am I treating? Do I like the way I treat? Would I do it on my mother or my daughter or my son? I congratulate you for clicking this link, because you have to ask yourself these questions. And if you are not content with what you have done until now, or you have this feeling that there might be more to it and you might be able to do it in another way, then welcome. I'm so glad to see you here. So just stay tuned and I'll show you how to do it. So keep an open mind and I'll help you as much as I can. Hugs from me, Rikitsa, and see you around. Thank you for listening.